I'm very pleased to say the Transport Secretary, Grant Shapps, joins us once again on the programme. Good to see you, Mr Shapps. Do hope you've been well since the last time we spoke. I wonder if we might start this morning with test and trace. £37 billion of taxpayers' money has been allocated to this system over 2 years. Can you justify that expenditure?
Yeah, it certainly hasn't been cheap fighting coronavirus, but it's absolutely been necessary. I mean, this is a quite strange report. 9.1 million people have been contacted by test and trace. These are people who otherwise would be wandering around, often unaware that they had coronavirus, and spreading it around further. So whatever the coronavirus experience we've had as a nation, good and bad, it would have been one heck of a lot worse if we didn't have a test and trace system which has contacted so many people and prevented the disease from spreading further.
I'm sure plenty of people will see the logic in that. Perhaps not, though, Meg Hillier, who correctly identifies. I mean, we know this from internal Department of Health and Social Care documents. We know that part of the point of test and trace was, of course, to avoid the second lockdown. And we didn't.
That's right. But did we know that there'd be the Kent variant, B117, at that time? No, of course not. Did we know it would be 70% more infectious? No, unfortunately, we did not, nor did anybody. But, the truth is, if we didn't have a test and trace system, if we hadn't contacted those 9.1 million people, this would have been one heck of a lot worse. And actually, I've heard a lot of odd things said, actually, now I think about it, about test and trace over a period of time. Oh, they're not managing to contact people and so on and so forth. Well, they can only do what people enable them to do. So if people provide contact details, it's obviously much easier. But I've got the latest figure here, for example, including people whose contact details were not given, they still managed to contact in total 93.3% of all contacts. So they've actually worked wonders. They managed to get hold of people even where they didn't have the contact details. And that can only have prevented faster and further spread of this disease, and therefore deaths as well. So, thank goodness it's been there. And as Dido just said in the report you just played, we are testing more per head of population than any other major economy in the world, by a long way, 2 or 3 times over most other countries.
And again, I suspect that there will be people watching this morning, looking at the numbers, looking at how many people have been tested and seeing a degree of validity in your response. Why then has Meg Hillier and the Public Accounts Committee arrived at such damning conclusions? I mean, we know, of course, as well, from last October, that SAGE were warning about test and trace. I mean, they said that they had only a marginal impact on stopping the spread of coronavirus. I mean, that's the government's own scientists. We've got the Public Accounts Committee. We've had any number of stories in the papers about the lack of efficacy to the scheme.
Well, look, I wouldn't want to pretend for one moment it's been completely perfect. That would be ridiculous. And particularly in the early days, of course, it just didn't have the facility. It didn't have the scale. This thing didn't exist a year ago. It's been put together from nothing. Something that even the Select Committee itself says is very striking, the extent to which it's been built up. But let me put a different perspective on it, if I may. Not only is it, as I say, carrying out all of these tests and tracing all of these people. Yesterday, for example, I think there were over 1.5 million tests done, and that's because as kids are going back to school, they're getting tested as well. Again, imagine if you weren't doing that. Imagine if I wasn't testing the hauliers, the lorry drivers going over to the continent. We wouldn't have been able to reopen the border that was closed just before Christmas. So to say that the whole test and trace thing has been a waste of time is factually untrue. We wouldn't have goods flowing. We wouldn't have medicines being imported because the entire export-import system would have frozen up. And then the other very good example of where it's worked has been with regard to these variants. I think I'm right in saying the number of variants from South Africa has been limited to 285. We know that because of test and trace. The number from Brazil, I think, was 6. We know that because of test and trace. So it's been very successful in doing things which otherwise would have meant that those variants, which are now the main concern for us, would have gotten out of control. So look,
I mean, we shouldn't forget we did have some difficulties finding the 6th Brazilian case of the Brazilian variant. But just one last point on this, because obviously we have much to talk about on your brief. A lot of people will look at, and it's in part you might think it's an unfair comparison, the 1% pay offer. that has been made to NHS staff, and the £2.7 million being spent on management consultants for test and trace every day. Look, everyone understands there is a role for consultancy within any government. People might suggest that £3 million a day is just a little bit de trop.
Yeah, I mean, look, you can always look at any budget and go, why are you doing this, but you're not doing that, or how are you doing this bit, but not that bit? I think
Kind of my job.
the NHS has had £60 billion more in the last year. It's got another £20 billion this year being spent on it, because we've got these extraordinary pressures on the NHS, and without hesitation, this government has provided everything the NHS needs to help get us through this pandemic. I've seen it firsthand. My dad's been in hospital and now, fortunately, in rehab for just over 3 months now, including having coronavirus in hospital during that time. The NHS has been absolutely extraordinary. I've seen it firsthand. Yeah, I'm sure we can pick apart the budgets and say why this, why not that. But overall, I think the NHS has performed phenomenally well and been extraordinary over this period.
We'll do pass on our very best wishes to your father. I hope he gets back to full speed very soon. Let's talk, though, about the announcement from the Department for Transport today. Millions of pounds being set aside, essentially, to do some kind of preparatory work for some quite big projects, some projects that I think many people will see as perhaps linked to the future of the Union.
Well, we certainly think it's a good idea if you can get around the United Kingdom, the Union, and you can do so easily. And what we've done is, in this interim report that's out today, is identified a number of different projects which, for whatever reasons, aren't particularly focused on within each different constituent part of the Union, in other words, England, Scotland, Wales, and Northern Ireland, but actually somebody needs to look at overall and say, this would help to make it easier to travel from, for example, Northern Ireland to England, which happens to be via a road called the A75, which is in Scotland. That's never going to be a particular priority for the Scottish government, but actually it matters for connecting us all together, making it easier for us to see our friends and family and do business together. So that's the purpose of this connectivity report, the interim version, which is out today.
Another aspect of this, which has been quite widely trailed, is the potential cut to APD, air passenger duty. Obviously, as Transport Secretary, you have a difficult balancing act. On the one hand, climate change, one of the mantras of our age. On the other, you want to get people travelling again. But can you justify, essentially, a cut to APD, which is encouraging people to pollute?
Yeah, I mean, first of all, air passenger duty was never introduced as a sort of carbon tax. It's not particularly designed for that either. So it's not terribly effective as a carbon tax. There are better ways to do that. For example, I want to see sustainable aviation fuels used in the UK, which would remove carbon out of the system largely, or indeed entirely. And we're already pledged to do that. We're going to get to zero carbon in aviation. But what this is about today, again, going back to the connectivity, traveling from literally John O'Groats to Land's End, is this bizarre situation where you pay less tax if you're flying to, say, London to Barcelona than you do if you're flying London to Edinburgh and back on the return journey, which is a somewhat bizarre situation. So what we've said today is we'll carry out a consultation. We'll look at how we can do this more fairly, and we'll ensure that people aren't penalised effectively for travelling within the United Kingdom, which is what we're talking about here, as opposed to paying less when you travel abroad and come home, which does seem like it must be the wrong way around. We'll make sure overall it doesn't collect any less tax, the system overall, and also making aviation zero, jet zero, as we call it, is absolutely essential, and we'll be talking about that more as part of this consultation as well.
You will have had, I'm sure, some bruising encounters with my colleague on the Breakfast Rotas, or previously my colleague on the Breakfast Rotas, Piers Morgan. You'll have noted, he has this morning, not apologised for what he said, and indeed has stuck to his guns. He has tweeted this morning, I'm reliably informed, I continue to believe that which I said, which was, of course, that he didn't believe Meghan Markle when she spoke about her suicidal thoughts. I just wondered what you made of that.
Well, putting the issue aside of what he was actually talking about, I'll miss the interviews with him. I would have been doing one in, I don't know, half an hour or whatever time I'm on Good Morning Britain this morning, and personally, I always thought he gave a very tough but usually quite fair interview. And as with all interviewers, I always find if you actually answered the question, you tended to have an okay ride with it, which was always, I was try and go on and just, if you didn't know the answer, just say, look, I don't know, or if you do know, or you give the facts. So personally, I'll miss him on there. I wasn't going to get into the details of the argument one way or the other with regard to Meghan, though. That's a rather different matter.
Why not? I mean, I'm sorry. I mean, it's
Yeah, no. Well,
a prominent broadcaster essentially
Yeah.
said on television that he did not believe someone when they spoke about their mental health. Now, at a
Well,
time,
it's
of course,
really-
when we're all very preoccupied with our own mental
it's
health, be you a royal or a commoner like myself, I just wonder why you wouldn't speak specifically to that.
Yeah. First of all, mental health is incredibly important, and particularly during this pandemic, even more so. And there are two things here, really. And first of all, there's a long-standing, I think, very good convention that cabinet ministers don't sort of comment on royal family matters like this. Often to say, I think we're very lucky to have a queen who's it's her platinum jubilee next year, 70 years on the throne. But the rest of this wider story, I know you will have discussed at length. People will have seen the interview. They will have seen the statement from the palace. I don't think it adds anything to have a cabinet minister get embroiled in that. And then secondly, you're asking me not only to judge that, but to judge somebody else's comments about it. And that drags me right into that territory. But on mental health itself, you will have seen just this week the government's put, I think, another £70 million into addressing some of the very serious mental health issues, I think, which arise not least from this pandemic. Being stuck at home has been very, very punishing physically, but also mentally for people. And I think recognising the stresses and strains of mental health outside of that particular royal story are very, very important indeed.